the treatment sequencing and headache for a patient who we consider, let's call them naive, meaning they've never really been on medication before. When it comes to acute treatment, the standard still is that you first try a triptan before trying any of the newer treatment options. And that's because the triptans are generic. They've been around a bit longer. And as long as you don't have contraindications, meaning you don't have cardiovascular or vascular contraindications, that you're a younger person that might tolerate this treatment well, it's probably still a safer, better place to start. Safer meaning that we actually have pregnancy registry information showing that if you're a young woman and you happen to get pregnant and you've been using a triptan, they're probably safer than if you've been using a gepant, where we actually have less data, and the data we do have in animal models suggests that potentially there can be some problems using a gepant in pregnancy. So if you're a young woman, probably a good place to start is a triptan. Now, if you've had side effects or it hasn't been effective, then the next step would be to try one of these newer medications, either gepant or ditan, depending on what type of migraine you have and what your preference might be, and also looking at insurance category. And so you're looking here to see, does a patient have a migraine in the daytime? Do they need to drive? Then you're going to go with a gepant. If the migraine tends to happen later in the day, or they don't need to drive and they prefer something that works a little bit more like a triptan, a ditan might be a good option for them. That's the usual consensus for acute treatment. For prevention, when it comes to CGRP category prevention, the general consensus is you try at least 2 oral agents that are generic that you've tried before. And if these are ineffective, or you have contraindications, medical contraindications, and there's any other reason why you don't want to start with the oral generics, then you write and document a reason for that, and you can move to the CGRP category. Again, we have a little bit more data on some of the older oral medications long-term for safety. We also have more information when it comes to pregnancy status and some of these older medications. Now, some of them are not safe, like topiramate is not something I'd want to put a young woman on who ends up getting pregnant, but there are some other medications that I would be a little bit less concerned about orally if they're on it and it's easy to stop. Whereas if they're on injectable medication, it takes about 5 months before it's cleared out of your system. Though the little bit of data we have from the WHO registry pregnancy studies, where there's about 90 cases of women who became pregnant after being on a CGRP monoclonal antibody, shows that so far things have been safe and there haven't been any negative reported outcomes.